All right, we're going to look at hip flexor length with the Thomas and modified Thomas, which is McConnell's. So you're going to instruct your patient to lay on their back on the table, pull one knee into their chest, and what we're looking for is the uninvolved hip. So this one's involved, this is uninvolved. The hip will come off of the table, or the femur will be elevated, indicating iliopsoas or rectus femoris tightness. If you see that their leg is off the table, we can do a modified position to see more. So you'd instruct your patient to stand in front of the table, put your butt cheeks right on the table, lie back and pull that leg into your chest again. We call this McConnell's stretch or modified Thomas. And from this position, you can see a number of different things. So we'll go over them in order. The first one would be if their femur is suspended above flat, iliopsoas and rectus femoris tightness. Secondly, if their tib fib is kicked out, that would be rectus femoris tightness. Next would be if their leg came inward, adducted, they'd have tight adductors, so adductor magnus longus, brevis, pectineus, and gracilis. And if their leg was abducted, out to the side, you'd have tight IT band or glute med or TFL, tensor fasciae latae. Next, we'd look at the rotators. So if she was rotated this way, she would have tight external rotators, so your 6 deep rotators of the glutes or hip. If she was rotated this way, which is pretty rare, she would have TFL and glute med tightness, or she would have femoral retroversion and she maybe would walk pigeon-toed. Am I missing anything from there? So then from there, whatever tightness they would have, so as our subject looking at her right here, she probably would have a little bit of IT band tightness. So we could correct all 6 things at once, but to correct her IT band, we'd bring her in. If it was hip flexor, we'd press down. If it was quad, we'd press in. If it was adductors, she's coming across this way, we'd line her up here. And if it was rotators, either in or out, you can use your foot or your leg to adjust. We want them to be in this position. Then you can grab that opposite foot and press down into a normal position here, stretching all involved muscle tightness is there. That would be your McConnell stretch or modified Thomas.